Our presenter today is ᴚᴜ Binetti. Laura is was one of the top female bodybuilders in the world. She has won the IFBB1999 World Pro Championships, 1996 European Grand Prix, and the 1994 Canadian Grand Prix. She has also won other awards for achievement and distinction, like the ᴡᴏᴜ Achievement Award from the Government of Italy and the Ben Weider Achievement Award. No longer competing herself, Laura now coaches numerous amateur and professional bodybuilders and specializes in pre-contest training and dieting. She is well renowned for the ability to get her clients into incredible shape for the day of the contest. Dr. Ken Kanakin will also be accompanying Laura for part of her presentation. Please welcome Laura and Ken.
Thank you. Thanks. I'd first like to take this opportunity to thank Dr. Ken for inviting me back to the Swiss Symposium and for being here this morning to assist me. The focus this morning is going to be twofold. We're going to take a look at weight training and programming for women. Okay? My love for weight training goes way back to 1983 when I started the physical and health education program at the University of Toronto. Back then I weighed a measly 105 pounds and did a lot of middle distance running. I was put on my first weight training program by one of Canada's elite Olympic athletes named Greg Joy. After about 8 months of weight training, I fell in love with the weight training, completely stopped running, and by 1990 I had completed several years of amateur bodybuilding, won the Canadian Championships, and turned professional. By 1995, I was considered one of the top 5 most muscular women in the world, now having a body weight of approximately 178 pounds and competing at 148 pounds. Okay? By 1999, I finally reached my ultimate goals and what I wanted to achieve in bodybuilding, and that was winning the World Championships. And I'm still proud to say that I'm the only female Canadian to have won the World Championships. And then on top of that, that same year, I finally placed top 10 in the Miss Olympia. So since then, I have been focusing on my own fitness consulting business, Body by Binetti. I've been fitness consulting for over 15 years. My next ultimate goal is to run the Toronto Marathon next year. And I'm also, it's a slow process, but it's coming along. I'm working on a Body by Binetti cookbook. But when I look at my whole focus and the core of my athletic career, it's all been about weight training. And when I look at weight training, the most important thing to me is always teaching proper technique and form of exercise. Okay? And that's what we're going to focus on for the first little bit. I'm not going to take a lot of time, but there's certain exercises that I want to show you the way I perform them that I know will make differences if you teach them the same way. Okay? When we're looking at weight training, the most important thing that I've learned is to make sure that you put the muscles through a full range of motion. Okay? When we're looking at range of motion, that means the further the degree of stretch, the more intense the contraction is going to be. And the most important word out of that whole sentence is intensity. And believe me, intensity of training is learned. Okay? And you do that by working in different combination of exercises in your program. So we learn how to do extended sets. We learn how to do supersets properly. We learn how to incorporate trisets. And the highest form of intensity is doing a strip set or a drop set. Okay? And how do you incorporate those into a program? Okay? So, the other part with full range of motion is always having enough resistance. Okay? If you don't have enough resistance, you're never going to change the shape of your body. Okay? So women that come to me very frequently, first thing they always say is they're doing a lot of cardio. Yes, they're going to lose a lot of weight, but they'll always be a smaller version of their bigger self. Okay? So it's adding in the resistance training, making sure that there is enough resistance in order to see change. And the only way to change the shape of your body, again, is through weight training. Okay? Customizing a program, the program must be customized to what the individual wants. Okay? Through my 1990, 1996, when I was at my biggest, a lot of women would come to me and say, but Laura, I don't want to look like you. And I can understand that. And the first thing I would say, and not to be conceited, would be, what makes you think you could? Okay? It takes a lot of hard work. Okay? So, customizing the program to what the goals of the individual are. Okay? So, just going to take the first little bit. We're going to go through some technique and form. Just going to pick like 2 exercises for each body part. Okay? The way I perform them, which I believe is the correct form. And then after that, I'm going to go through some, what women always complain about is stomach, butt, hamstring area. And I'm going to go through some very simple circuits that you can do. You don't even need a gym. You can do them at home. But they're effective and they work. Okay? If done correctly. Okay. So let's start with the smallest muscle groups. I'm going to start with biceps because that's my favorite. I'm just going to do 2 exercises. I'm going to do a dumbbell concentration curl. Okay? And a standing barbell curl. Okay? So one thing that with biceps, one thing that I never do is I never twist the wrist at the bottom of a bicep. Okay? I never supinate the wrist. I always want to start the muscle in a full stretch position. So this is my position for a bicep curl. Okay? I never lock my elbows in. Okay? I'm nice and loose. Okay? When I'm doing a standing alternate dumbbell curl, okay, I'm not coming to here. Okay? What I want is a full stretch of the bicep. What I'm going to do is I'm going to lift the elbow up and bring the dumbbell close to my shoulder. Okay? What am I doing? By lifting up, I'm working on the peak of my bicep. Okay? So we want a nice baseball-shaped bicep. Okay? So, if I'm doing a dumbbell concentration curl, again, I want to make the exercise as effective as possible. Okay? I never lock my elbow onto my leg. Makes the exercise easier. I want a full stretch of the bicep. So I extend the arm to the ground. My body's nice and tight. My stomach's tight. Don't bring the elbow in. I leave the elbow where it is, and I bring the dumbbell up and around into my chin. Okay, so it's up, squeeze. I'm going to power up, and I'm going to control on the way down. I'm going to power up, squeeze, control on the way down. Power up, squeeze, control on the way down. Okay? The angle is at approximately a 45-degree angle, not at a 90-degree angle. Okay? You can get a better peak on your bicep with a 45-degree angle. Okay? Standing barbell curls. I love this one. Women always tend to listen to me. Men have a little bit of a harder time, but okay. Remember, always want to start in a full stretch position. Whenever I'm doing any exercise, you always see my body stance. My feet are usually shoulder width apart. Okay? My knees are always slightly bent. That takes the pressure off my lower back. I'm always slightly leaning forward. I call it the skier stance. Okay? Starting with my biceps in a full stretch position. Okay? My wrists are flexed at the bottom. I'm not letting my wrists go. Okay? So, most people instruct this to bring the bar up and down. To work on the peak of the bicep, again, we're going to lift the elbows higher and we're going to bring the bar to our nose. So we're going to come up and around, squeeze. Bring it down naturally on the way down. So we're going to power up, squeeze, control on the way down. Power up, squeeze, control on the way down. Power up, squeeze, control on the way down.
Now, when she's doing this, the other thing, if I can add, is she's working both heads of the bicep. In muscle testing, when we're doing this muscle test here, and it's like this, that basically tests a short head. If you're going to test a long head, you're up like this, and you're bringing it down. So that's when she's talking about the peak of the bicep. She's working both heads of the bicep, which a lot of people do not do.
Any questions? Please feel free to ask questions anytime. Okay. Leaning slightly forward. My stomach, my whole core is nice and tight. I'm going to power up, control on the way down. Power up, squeeze, control on the way down. And ask my clients the same thing that I said to them. Power up, squeeze, control on the way down. Power up, squeeze, control on the way down. Yeah.
Will this technique hurt anyone who has any AC ligament problems?
Okay, you've got it.
Yeah, just repeat questions.
Oh.
What was your question again? We just got to repeat it.
With that curl, it fires off the stabilizers in the anterior deltoid a little bit. Will that cause any pain for anyone who has any problems with the AC ligament here? Prior AC ligament here?
Possibly. If it's unstable enough, It will cause it because the long head of the bicep goes through that. But guess what? It's also probably an exercise that will help strengthen it through that. So it depends on the actual grade. If you're dealing with a grade 1 or 2 AC separation, you know, it's probably not as bad. As you go higher to grade 3, then maybe a little bit unstable. And you can, if someone has an unstable shoulder, a trick that you can do is just put your hand on their shoulder. And if the whole shoulder kind of clunks down, it's probably not a good thing, okay? So, but what you can do is you can do an exercise that is identical to what she's doing, and it's an isometric one where it's in this position here, and she would push up, and then she would push down. And what that does is an isometric contraction of the long head bicep, which would help stabilize it. But again, it depends on the instability.
You've got to remember too, and I stress all the time, full range of motion of exercises. When you're sitting down with a client, the first thing you're doing is getting all of their background information, okay? So you want to know all of the medical history, any injuries that they have. That's very important. And then customize the program around that, okay? So that's biceps. Triceps, I'm just going to take a look at 2 exercises, okay? And the first one, again, and all I'm stressing here is putting the muscle through a full range of motion and a full stretch, okay? So one arm dumbbell extensions. I do this slightly differently, okay? Slight different angle. And I do like to have my back supported on this. So dumbbell starts straight up. Most people will take the dumbbell and take it over to the other shoulder, up, squeeze, okay? I like to have the elbow come out, drop the dumbbell to the midline of the head, come up, and squeeze, okay? You're going to feel a bigger stretch on your tricep, okay? Take the dumbbell at least down to the midline, okay? Half down the head. If you can stretch it more, it's going to touch the back of your neck. Power up, squeeze. I'm not coming out here, straight up to the ceiling. Let the elbow come out, power up, squeeze. Bend, up, squeeze. Bend, up, squeeze. You notice my body's tight. I'm in total control of the exercise that I'm doing. Feel the exercise. That's learned. Okay? The one other thing that I do slightly different, a slight different angle, is a lying tricep extension with the bar. And again, a lot of times called skull crusher. Instead of bringing the bar over the forehead, I take it to the eyes. Okay? That way, I'm going to get more of a stretch on my tricep. So, I'm here. My body's nice and tight. I'm going to bend at my elbows. It's going to come down to my eyes. Power up, squeeze. Bend, power up, squeeze. Bend, power up, squeeze. Bend, power up, squeeze. Okay? Instead of coming over the head.
Now both of these motions work the long head of the tricep. Maybe could you extend your arm out? Show. So the long head of the tricep is this section here. Other exercises that the arm is close to the body will work in this area, more the lateral head, to give you the full horseshoe shape. What would be an exercise that you would choose for this one here?
I like to isolate by doing all cable work.
Okay.
Okay? So one arm push down, reverse grip, overhead reverse grip. Okay? Always switching it around. The lying tricep extension I consider a power exercise. It would be an exercise to start off with. Then we look at shaping exercises.
One thing with the tricep that most people don't realize is you need a lot of weight. The long head of the tricep is known as the lazy head of the tricep. It will only be activated either with it overhead or with a lot of weight. So close grip bench press is tremendous. But if you're doing a lot of push downs and expect this muscle here to grow, it doesn't. It's usually more the lateral head. Yes?
Are you taking it triceps when you, the long head, when you do the traditional way of using the other arm to hold the humerus in and extend like this? Are you taking out the long head then?
No.
I notice Laura does it out here as opposed to holding it.
That's fine. The question is, if the arm is up overhead, does it still work the long head of the tricep? Absolutely. As long as it's here. It really doesn't make any difference here or here, as long as it's in the up position.
You usually recommend keeping it adducted, I think, from the first I've done with you. Any comments on that? Keeping it adducted with the other hand versus letting it clear out? Any comments on that or opinions?
This is, go ahead.
Again, I always listen to what my clients are telling me and the way they feel the exercise. If they feel the exercise more that way, absolutely, okay? But again, I instruct it. If they can't do it properly the way I'm showing them, then they have to do it at the angle that's comfortable for them.
What you're going to find with exercise, everyone has their own style, their own nuance. There is not one style. I prefer it this way because I get more of a stretch in that. Laura's going out here because she feels that she can get more of a stretch that way. They both work. There is not one. The perfect technique is the perfect technique for the person you work with. That's the actual art of training people. The science is, okay, what does it work? The art is fitting that exercise to match them. And she's actually one of the best in the world that I've seen because she's able to see exactly how to change it. If she was to work with you, some of the things that she would be doing here would be modified to suit your biomechanics, correct?
Absolutely.
So you always...
Increased injury risk.
Not at all. No.
Okay. Shoulders. 2 exercises. Seated side laterals and front alternate raises. Okay, your lateral movements. 2 very common exercises. I don't usually incorporate many trap exercises in my workouts because I incorporate that in with shoulders. So we shrug all lateral movements. So when I'm doing a lateral movement, I'm just going to take it just a little bit past parallel to involve the traps. But it's done in one motion. Okay? And the same thing I'll show you with the front alternate raise. Okay. Whenever I'm seated on a bench, I'm always sitting right at the very end. My feet are together, I'm up nice and tall, my chest is out, I'm slightly leaning forward. Okay, my skier stance seated. Okay? I'm leaning slightly forward so that I have a stretch in my shoulders. Okay? Dumbbells are right down at my side. I'm going to throw them out to each side of the wall. I'm going to power them up and I'm going to control on the way down. I'm going to go just past parallel. Okay? To involve the traps at the top. So dumbbell straight out. I'm going to keep my arms straight. Okay? I'm going to have a little bit of motion in there, but I'm in total control of what I'm doing. My stomach's tight, my upper body's tight. So here I go. Up, resist. Up, resist. Up, resist. Up, resist. Up, resist. Okay? Seated side lateral. When I'm going into a front alternate raise, again, I want to put the muscle through a full range of motion. Okay? Most will be instructed to start with the dumbbell out in front. Okay? I start with the dumbbells slightly to my side and behind. Now my shoulders stretched. And you can see that motion just from here to a stretched position. My knees are slightly bent and I'm leaning forward slightly. I'm going to throw the dumbbell to the wall and I'm going to resist on the way down. So, actually I'll do it sideways for you.
Yeah, you're going to fly off your mic here.
There we go. Okay, so it's up, resist, up, resist, up, resist, up, resist, up, resist. Okay? Now, I'm not throwing the dumbbell up to the ceiling. I'm controlling it here, getting the trap involved, resisting on the way down. You'll feel that right through the front of the delt. Okay? There's one other exercise that, same thing, upright rows, which is fairly common. Again, we want to start in a stretch position. So I'm not starting here. I'm leaning forward slightly. Bar is right in front of me. And I'm going to pull up to my nose. Okay? So instead of pulling up to here, I'm going to get the traps involved a little bit more. I'm going to pull up to my nose. So, full stretch, power up, resist. Power up, resist. Power up, resist. Power up, resist.
What does a change in your hand position do with that exercise? So if you're to take your hands out wider, does that involve less traps, more deltoid?
Yeah. What happens is, the question is, as you move your arm out, what happens to the actual muscle? When it's in this position here, the trap has 2 functions. Shrugging the shoulders, but also bringing the arm up. So the closer it is, you're bringing this here, the arm is up higher so you can work the traps. As you bring the hands out, it's going to work more lateral delt because you can't bring it up as high.
I find too that with the upright rows, the further out you are, the exercise is painful. Okay, so you want to bring the hands in just slightly closer.
If someone does have an AC problem, any type of shoulder dysfunction, that would probably, there's two different concepts. There really is no contraindicated exercise. There's more contraindicated people. So you take a look at the people and see what fits them the best. Some people may not be able to do this exercise due to the shoulders. People always look at this exercise as contraindicated. Football is contraindicated. You got a 300-pound guy that wants to crush you into the ground. So when I'm teaching, chiropractors on things like good mornings and power cleans, they're like, well, isn't that hard on the back? Isn't that contraindicated? Not for sports, not for professional athletes. For someone that's, in their 70s and just wants to, tone up a bit, that would be contraindicated. So you got to choose the exercise here. So there'll be some exercise that Laura's going to show and you're like, yeah, but I can. You said, this. That is true. Dependent on, I compete in powerlifting. I lift heavy weights for no particular reason. That is contraindicated also, but I really enjoy it. So, what's the next exercise, Laura?
Okay, quickly chest. Okay, we're going to take just two exercises, your flat dumbbell press and a flat fly. The only thing I do different with this is that with presses and flies, above the eyes at the top of the exercise. Okay, the function of the chest is to draw the arms inward. Okay, and I'll show you that with the flies. Okay, but presses and flies bring it down naturally to the chest, underarms, but you're going to press up and see the dumbbells above your eyes. And you'll feel the difference when you do it. Guaranteed.
Did her mic just kick out? Yeah. Okay.
You know what? And I'll do this backwards for you too, and see it work. Okay. Dumbbell presses. Okay. I'm going to start with the dumbbells above my eyes. I'm going to come down naturally, okay, to the shoulders, not here. Okay, to the underarm, power up, squeeze. Bend, power up, squeeze. Bend, power up, squeeze. Bend, power up, squeeze. Flat flies. Dumbbells start above the eyes. I'm going to bend my elbows, come down, comfortable stretch, power up, semicircle up, straighten the arms at the top. Bend, power up, squeeze. Bend, power up, squeeze. Bend, power up, squeeze. Whoops. I'm stuck.
That's a contraindicated movement.
Okay. So flat dumbbell press, same thing you're going to do when using bench press, incline barbell. Okay. Press above the eyes. Okay.
At the top of that movement, when you're fully extending the arm, so you're not really keeping the front deltoid, you're only the chest or not?
Well, slight. I mean, there's always going to be secondary muscles involved. Okay. But without squeezing it, you will feel it right through the chest.
It's one of the toughest exercises to teach because that squeeze to the top, they're unsure of how to get that contraction. They don't know. Should you have a slight arch in your back?
No. It's a feel and it's practice. Okay? So it's not going to happen the first time that they go into the gym, unless they pick up really quick. But it is practice.
Yes.
In other ways I've seen flies done, you can always, some people tend to arc out a bit more with their arm where you came down more. What's the difference there?
Okay. The question is, when coming down, a lot of people take the arc a little wider. I take more of a bend in the arm. Again, I feel that when you're keeping the arm straighter out, it puts more stress on the shoulder. Okay? And my whole goal on that exercise is to work my chest as much as possible. Okay? So I'm going to take a little bit more of a bend, feel the stretch that's comfortable through the chest, and circle it up and squeeze. Okay? To do a straight arm fly, okay, I'd rather use a machine. Okay? And use the rear delt machine or straight arm fly machine in order to keep your arms straight.
Check one.
Good. Next.
Okay, legs. Okay? Squats and lunges. Okay? I do believe in a full squat. Again, listen to what your clients are telling you, and you've gone through a consultation, so you know if there's any knee problems or anything. But, okay. Okay, now I'm not a big believer in feet out, feet in. Full squat's going to work your full leg, it's going to work your butt, it's going to work your inner thighs, it's going to work your quads. Okay? So, feet shoulder width apart. Okay? Nice and straight. Okay? Hold on to the bar tight. I'm going to come down. Get used to the exercise first. Okay? When I say butt to heels. I'm going to control on the way down, power up. Down, power up. Down, power up. Now, when I'm working with women and we're working on high reps, okay, I want the motion to be continuous. I want the tension on the quad throughout the whole time. So, I'm going to go down, up, down, up, down, up, down, up. When they're tired, you rest at the top. Catch your breath, continue the reps. Okay? I like to use a Smith machine for squatting. Okay? Unless I'm working with a higher end bodybuilder, okay, and we're still in the process of really, really building up the muscles, then we'll use free squatting. If not, safety, Smith machine. And what I see a lot of the times too with instructing on the Smith machine is, remember, you want to stay right under the bar. Your feet aren't way forward on it, right under the bar. Okay? When I'm doing lunges, a lot of trainers will instruct walking lunges. That's fine. The only thing is that when you're walking forward, you're never getting the push back on the leg. Okay? So I like to do alternating lunges. And again, it's just a step forward and a push back. Okay? It's a great shaping exercise. It's a great exercise for inner thighs and butt. You're going to feel it. Okay? So, body's nice and tight. Stomach's always tight whenever you're doing any of these exercises. I'm going to step forward and push back. Step, push. Step, push. Step, push. Yes, I'm pushing with the ball of my foot, not my heel. Okay, it gives me more power.
The further out that you go, the more that it'll work the glute. So it all has to do with the amount of bend within the knee.
Yeah, and be careful too. It's also going to depend on your flexibility too. And sometimes, just be careful, the further out, okay, a little bit more stress on the hip flexor. So work up to the stages, okay? Dumbbells is fine. I prefer to use a bar just because the weight is more stabilized through the back. Okay, so, and I have something to grip up here. Okay, and then you have more stability with the bar on your back. Okay, but a lot of the women can't even start with this type of weight. So it's either no weight or they're starting with 5 pounds in each hand. Okay, so you want to work your way up.
You said when you do squats that you put your feet under the bar in the Smith machine?
Yes.
If you do that, your knees will go past your feet.
Okay, the question is, when you have your feet right under the bar on the Smith machine, then your knees are going to be going over your toes. Okay? I'll have Dr. Ken.
If you're going to work the quads, the knees do have to go over. Again, don't look at things as contraindicated. You take a look at what the person is capable of. So like Laura was mentioning at the very beginning, if someone has a flexibility issue, you may have to modify where the feet go, or actually not even do that exercise. These are advanced type of concepts that she's introducing you to that will literally take some of your training, because we're always looking for what's the neat little tricks that we can do, the concepts and everything else. So if someone has a knee problem, going down like this, maybe it may be a problem. If you don't, take a look at, guess which athlete does this tremendously? Olympic lifters with extremely heavy weight. If anyone was going to have knee problems, it would be Olympic lifters, because they're going like this, they bring it up, and they go down so far that their butt sometimes actually touches the floor. That's a really, really deep squat with their knees driven forward, and then they come up with 300, 400, 500 pounds. And some of the studies have shown they actually have better knees than the general population. So you really have to start thinking about, you know, this is contraindicated, this is contraindicated. We've gone too far as labeling exercises instead of really identifying what is going on with the person. And that's actually why I created Swiss, because there's just so many unfortunate, poor information that was basically said globally. And the squat was the one exercise that was out there. How many people here have heard squats are bad from the knees? Do you know where that came from? That came from 1954. Dr. Carl Klein at the University of Texas did a study. He took 200 people. 100 people didn't squat. The other 100 people did squat. He got them and he pushed on their knee to see whether or not the knee would collapse. And he had a little instrument to see how much it would actually change. So he's testing the ligaments. Before you got on the table, he would ask you, do you squat? And if you said yes, he would push harder. And if you did squat, he wouldn't push as hard. His study has never been reproduced, but Sports Illustrated picked up that article that he wrote, and for the next 30 years told everyone squats are bad for the knees. Then in the 1980s, through National Strength Conditioning Association, he started doing studies, and he took squatters that squat 600 pounds, 700 pounds, 800 pounds, and measured to the general population. Their ligaments were tighter, and they had less x-ray damage, less degeneration than the general population. And these are guys that are squatting extremely heavy weights. So that whole idea as far as, you know, the knees, it's dependent on the person. Always, always remember that, okay?
And for a lot of women that, I do programs for, a lot of the times if we get under the squat machine, you absolutely know from the first and second rep if they can do it or not. A lot of times the balancing thing too, the feet, if they have to lift their heels, you know what? They just can't do it. You want to strengthen up their legs first. So I will take them to a very easy leg press, okay, more of a life fitness machine than even a regular leg press machine, and start strengthening up their quads and hamstrings with just leg press, leg extensions, and lying leg curls, and then follow through to a squat. Yes?
Just a comment, you indicated you don't like walking lunges because you don't get the push back. Could you not follow your forward walking lunges with a set of backward walking lunges?
Okay, the question is, with walking lunges, I like to alternate them because you get the push back. Walking forward, can you not go back? Okay? I like to keep a motion very natural, keep it simple. Okay, so do I want to go back with it? I wouldn't. Would it work? Probably. But I like to keep it very simple for my clients. Yes?
Most of their trying to lose weight, put on muscle on them. What are your set recommendations for squats?
Okay. The question is, for squats and lunges, what is the rep scheme? For women that don't want to put on a lot of muscle, and we're looking at toning, okay? I'm going to go through how to put the exercises together in rep schemes, okay? But for a female that just wants to tone, I will keep the reps high, okay? Lunges, I usually won't go more than 15 on each leg. Squatting, I will go anywhere between 20 and 30 reps as an extended set, okay? Okay. One more exercise, and then we'll get to sequencing of exercises, programs, combination of exercises that work really well. Just one exercise for back. One thing we always want to combine, okay? We want a nice shaped bicep, tricep, and a nice cap on the shoulder, and we want the lats, so we get that nice V taper, okay? Remember, whenever you're doing your back exercises, I get this comment a lot of times. Every time I train back, all I feel is my biceps working, okay? Obviously, you're pulling, but you have to get that full stretch, okay? So most people pull down to the front. Okay, they're here, they'll pull down, they'll come up, and they'll stop right here. I don't have a full stretch. Let your lats go, okay? So it's a full stretch, power down, control on the way up. Power down, contract, reach up, okay? So full stretch when you're doing any back exercises. That will work on widening your lats, okay? I love the one-arm dumbbell row, okay? remember, on a one-arm dumbbell row, we want a full stretch of your lat. So I'm going to stay right at the end of the bench. Dumbbell's going to come right down to the ground. Okay, now I could start here, as most will, but if I stretch it to the ground, my lat's stretched. I'm going to power up and I'm going to control on the way down. I'm going to keep the dumbbell straight, okay, instead of pointing it up. It's harder to keep it straight or slightly pointed forward. Get more of a stretch, okay? So here I'm going to power up, stretch. Power up, control on the way down, stretch. Up. My stomach's tight, my upper body's tight. Okay, I'm in control of the exercise. Power up, stretch. Up, stretch. Up, stretch. Okay? For someone that's never weight trained, yes. Are you going to slow it down a little bit? Yes, let them get the form. Okay? Once they've got it, though, get some power into that exercise. That full stretch. You got to be in total control.
Next muscle group.
That's it. Chest, back, shoulders, arms, legs. Right? Those are the main...
Calves.
Calves.
Abs.
We're coming to abs. Okay.
What do you do for calves?
For calves, I always pick...
Do you need to do calves?
Yes and no. It depends on what the goals are. Okay? For the bodybuilders, absolutely. For my general fitness, no. I think it's a waste of time. I'd rather put that time into doing some ab work or a little bit more cardio. Okay? But calves, okay, again, I don't believe in the feet in and out, okay? Feet straight forward on the machine. I like standing. You always want to switch your exercises around. That's what's important. So I'll usually pick 2 exercises for calves, and I'll usually ask the client what exercises they feel the best, okay, when they're doing calves, and then just switch them around. So I always like to, again, power up onto the big toe, control on the way down, but a full stretch. Okay? Power up, squeeze, control on the way down. Okay? Toes pointing forward. It's that power up and the squeeze at the top. And you need that stretch at the bottom. A stretch that's comfortable on the Achilles.
The big thing that she mentioned here, which a lot of people don't do, is they go like this and they just go up on their toes. Did you hear what she said?
Power up.
Power up.
Squeeze.
And go up on the big toe. If you go up on the big toe, it contracts the calf even more, especially the gastroc.
Okay? And just switch the exercises. So seating, calf raises are good. I like going to a leg press machine, okay? Because I can do 2 legs and then I can isolate with doing 1 leg at a time. Okay? Just always switch it around. You always want to start with warm-ups and then 3 to 4 working sets of each. You don't need much more than that. They'll get exhausted. Okay? Working them every other day.
What do you do for forearms?
Okay, I never incorporate forearm work into my programs unless it's sports specific with someone coming to me. Okay? Every time you grip, I've never worked forearms in 15 years, my training. Every time you grip the bar, you're working your forearms.
Okay.
Okay? Now, women don't have problem with that. Again, a lot of the men might have problem with that. Okay? But, you know, talking to a lot of even my male bodybuilders, again, it's extra time that's not needed. It's wasted time.
Did you want to talk about your low back injury with the disc? And then, because people think that you can't do heavy training if you've got a back injury.
Okay. Dr. Ken, in my whole 15 years of training, okay, I've had 1 major injury, okay? And basically for me, it was just overtraining, and I also had a lot of running involved in that year also, but I have had back surgery done. I had a herniated disc in 1990. I dealt with the pain for over 2 years. They wouldn't operate on me. So same thing, I'd be okay for a few weeks, and then I'd do something, and here would come back the pain. I had quite a bit of nerve damage from the sciatic nerve. And I did have the operation done in 1990. I lost feeling I have no reflex in my ankle, and I have no feeling on this left side of my leg, okay? That's the worst injury that I've had, but I tell you something. Again, I went into that operation being in very good shape, and came out. It was really, really successful. Within 3 weeks, I was back in the gym, okay? Very light training, but within 8 weeks, I was squatting, I was deadlifting, I was doing anything. The doctors were telling me that I need at least 6 months off work, 6 months not in the gym. So, I mean, we're all different, but I came back very well from that. And when I look at, you know, I get a lot of people that come with me with back injuries. So important, be careful, lots of stretching, but training is so important still at the same time. I'm not a doctor, but when they say to just relax and not do anything, I'm totally against that, okay? I'm not saying to go into the gym and to weight train, but definitely lots of stretching, a little bit of walking as much as you can do. Don't let it stiffen up on you, okay? They will not operate also until it comes down to it has to be done. What happened to me was after 2 years, I started to lose my bladder control, and as soon as that happened, I was in the hospital right away. But they would not operate because I keep getting better, and I mean, I keep weight training through it. So when the pain would become that bad, I take 1 or 2 days off, but I always stretch.
So from a lower back surgery of a disc herniation, you still competed because when was your peak? What year?
My peak for competing was 95, 96, and then what I was getting, the feedback that I was getting was I was just too muscular. I just wasn't going to place where I wanted to place, and I wanted to make top 10 in the Miss Olympia so bad, so it was like, okay, you know what? I've got to tone down my body a little bit more, and I did that for 99. Took me a couple years.
But you were able to come back and train professionally with...
Harder and better than
Harder.
ever. Than ever. Some of the weights that I lifted, and I sometimes wish that I had some of this on video, it was phenomenal. I mean, I'd be training in the gym, and a lot of the time people would just stop, especially when I'd be squatting, when I'd be doing any type of bench pressing or dumbbell press. They would stop around and just watch. So I went from, you know, that surgery and 2 years later, squatting, and when I say full squat, I full squat. My butt comes down to my heels with 3 plates on each side, okay, for 5 reps. If I was doing reps, high reps, 20 reps, I could squat 20 reps easily with 2 plates on each side.
What was your best dumbbell incline?
Best dumbbell incline I did were 100-pound dumbbells for 5 reps. Okay, that was at my very peak. Okay?
That's impressive.
I was pretty strong. So, and you know what, and that's the only time, other than that, I have never had any injuries through my weight training, okay? All my other injuries have happened from other activities.
What I want to emphasize here is that she had lower back surgery, and a lot of times as physicians, which a lot of times it's inappropriate for them to say, don't do anything. And they haven't been trained in normal rehabilitation. The more advanced that you get, the more you see that the faster that you're able to come back from surgery and do some rehabilitative work, the better off that you will be. So again, you got to work with people that understand it. Just because someone is an orthopedic surgeon and they say don't do something, get a couple of more opinions. Don't just take one's opinion because it may be the wrong information. And that's what we see time after time. Well, look at my field. Never see a chiropractor. He's going to hurt you. Have you ever been to a chiropractor? No. They know absolutely nothing about what I do, and yet we're able to make big changes. So always take that type of information. Just because you have an injury, don't make it a death sentence. Make sure that you're able to continue on with other things, but do it intelligently. There was a question here?
Yeah, it's a question. By the way, what you did was and, like, I was just how low do you come down on a bench press, on that flat barbell bench press, and what was your maximum weight?
So the question was, how far down do you go down on the bench press?
Right down, I touched the top of my chest. Okay, so stretch that's comfortable, but that is a full stretch. Okay, right down to the top, controlling it down, power up. I will touch it.
Yeah. Now, are you thinking that if you bring it down, it's hard on the capsule? Is that what you're thinking? It depends on the position of the shoulder. So the further out that you go, one thing that would probably be really hard is if you go down to the collarbone and you bring it down. Now, there's some people that are really flexible. If you don't believe me, go to Cirque du Soleil. My gosh. Some of these people are incredible, and you're going, well, isn't that contraindicated? Yeah, it is a little bit, but they can do it. And you talk to them and they're not in pain. If someone does have a shoulder problem and you're worried about the capsule, bring it down to 45 degrees. If you go in this position, it's less stress through the actual shoulder capsule. You can still go down. In powerlifting, we actually have what is known as a U-shaped bar, where it's a 4-inch drop, where you actually go down an extra 4 inches for explosion. That's what you also do with dumbbells. Again, work with people's strengths and weaknesses as opposed to what one person said or a book said. Because guess what? Dr. Serrano next door is given a lot different information. He brought a couple of dumbbells in that are bizarre looking. They got one peg goes this way, one peg goes this way. And so he's doing some pretty interesting things next door. Do they work? Dependent on the person. What Laura's talking about is getting people in phenomenal shape. Doesn't she look phenomenal?
Yes.
You know what? And that's unfortunately is the stigma a lot of times, is that you can't, look good, in competing in bodybuilding. You absolutely can. Is it taken to the extreme? Absolutely. But that's the sport. Look at male bodybuilding. 300-pound guys that are absolutely ripped. Is that normal? Absolutely not. And you talk to these guys, and they're actually not real happy with being that size either, are they?
No.
No, they're not. But they have to do it in order to perform. No different than football players. These guys don't like being 350 and having to breathe hard, but in order to perform, they do. They
Ken, at 100, I'm 5'3.5", at 178 pounds, let me tell you. That'd be usually over the winter time. I don't think I wore jeans for 7 years. It was tights and the long sweaters to cover me up. But you know what? But I did it for a reason, because I knew that the next year I was going to be bigger and better on stage, and that was my goal. Okay? They may have not placed me in the top 10 in the Olympia for 10 years, but they were not going to look at me, and they were never not going to see an improvement with me. Okay?
Yes, question in the back? So the question is there an exercise to work the, so this area right through in here?
Okay. I like to do combination of exercises, so not just one exercise, okay? So again, depending on what program that you have if I'm talking about body part training, okay, I would have her do 5 exercises for her back, okay? So I'd start with a pull down exercise, okay, which every time you're squeezing down, okay, you're working the upper middle, okay? I would add in a seated row, okay, to get more of the middle. I would add in a one-arm dumbbell row.
Okay, so I understand that. I know different exercise. I just wonder if there's a technique that works better for those raising the back and those striking together.
Yeah, there is one. She was doing a dumbbell row in this position in this way. If you bring the arm up like this and you do a row in this position, her rhomboid will basically help stabilize and pull that. So you can either do that on a cable straight forward, you can do it on a I teach my patients to do it with the arm out in this position here, which will work the upper back rhomboid area. Does that answer the question? Yeah, great, thanks. Yes?
Any comments for the average woman? I have a lot of women in general chiropractic practice who are hunched on their laptops all day. They refuse to go to a gym, and they get this nasty dowager's hump thing happening. What would you do to work against that? What would you recommend?
So the question is that women, or men too, that are in this position for an extended period of time. The very first thing is, it's not an exercise, it's postural training. So what you have to do is modify. Because I give them the best exercise, you know what? Doing 90 seconds of an exercise isn't going to overcome 10 hours of being humped in that position. So the way that you do that is you teach them on how to sit, which most people don't even realize. They're in this position, and the way that you can check what's going on is take a look. You do a postural test. If someone is standing, you want to see their index finger and thumb. Can I borrow your pen? Can I borrow your pen? This is called the pencil test. So what you do is you just have someone hold on to 2 pencils, and they're just standing like this. Have them bring it up and bring it down. The pencils should be facing forward. So guess what? The position of the shoulder as well. If it's 45 degrees, you can basically start doing some stretching exercise. If they're in this position here, and you probably have seen a few of the no-neck gentlemen that are here this weekend, and they neck optional, and they're walking around in this position, they have a lot of internal rotation of the pec minor, but also of the subscapularis. This isn't something that you can stretch out. This is something that you're going to need to have treatment on to do some myofascial work to bring it back into this position. So that's the very first thing, is to analyze exactly what position they are. If they're in this position, you can do some flexibility. Postural training, the best way is everything is led by the chest. You don't want to be doing this. You'd look a little goofy walking down the street in this position. What you want to do is have your chest high. As soon as you do that, it changes the mechanics. So they can sit in this position, but they become lazy and gravity takes over.
That's we need exercises to sustain that proper posture, right?
No.
And to reverse the...
No. The exercises will not overcome the postural difficulty. You can do some exercises, and there will be a few. The one-arm row will help do that, but unless you change the posture, the strengthening, because you're still dealing with gravity, and it's just a bad habit. That's what I've seen clinically. Because I've tried every single exercise, and until I started working with their posture and changing it, it was a waste of time.
And you'll notice what I've said too, whenever I'm doing my exercises, again, I'm up nice and tall and my chest is out. Body's tight, your core is always tight whenever you're doing your exercises.
The other thing you can do to find out just how tight it is you can, if Laura turns, if I take my hand and I position in here, see how I'm on the anterior delt, basically posterior delt, and it's in this position. You'll see a lot of people, you want to see whether or not the shoulder has rolled forward or has the arm internally rotated. If her shoulder, you just kind of pull your shoulders forward, you'll see a lot of people in this position where it's all of a sudden forward. So this is something you're going to have to work on the pec. It's not the exercise here. This needs to be stretched out. This is what I'm seeing more clinically and in this position. But if she's like this with her arm like this, you're going to have to go inside the subscapularis and start basically working that to decrease that internal rotation. Okay? Yes?
Do you do exercises to stabilize the shoulder joint?
Do you do exercise to stabilize the shoulder joint?
I like to work a lot with all the lateral movements, okay? If I have an individual, and again, just a weaker individual, I will go to the machines, okay, because they can't do anything wrong in a machine, okay? A very light shoulder press machine, but I also have to look at the angular machine, what machine they're using. So it's going to depend. But unless it is a serious, serious pain, I will tell them to please continue to do an exercise, okay, that I've put together in sequence, but just light weights, okay? You're still stretching out the area.
Yes?
Do you do many exercises to strengthen the hamstrings, abductors, and adductors?
Yes, absolutely, especially for the women. It's always,
Go another half hour.
they always come the first thing. It's my stomach, okay? It's the butt, hamstrings, and thighs. 3 exercises that I always like to incorporate, okay? And I don't like the inner and outer thigh machine, okay? If we're looking at doing weights, one-legged leg press machine, alternating lunges, and step-ups, okay? With a one-legged leg press, and keep the reps high. With a one-legged leg press, it's the only exercise that I never do a full motion. It's to a 90 degree, okay? So I want to keep the tension on the quad and a constant push, okay? By coming all the way down on a one-legged leg press, it's just a little bit too much pressure on the hip flexor, okay? So I'll do it in a circuit. A lot of the times I'll do the butt hamstring circuits after they do their cardio. So they've done their weight training, they're doing their cardio, and they're going to go to a butt hamstring circuit. So I do like to use the resistable with this, okay? And you usually like to stick to 4 exercises. switch them around, and instead of a rest period in between the 4 exercises, we're going to do abdominal work. Okay? The thing is, you always want to switch the workouts around. So every time you're going into the gym, even if you're just starting with someone and doing full body routines, you should have at least 4 different workouts for them to do. So you're always stimulating the muscles differently. That way they're going to get results. I always say, if you haven't seen results with a personal trainer within 3 weeks, you've got the wrong personal trainer. Go to someone else.
Just to let you know, in the notes that I cryptically, Pentagon-wise did, she has week 20, week 15, week 10, week 5, and week 1 of all the different exercises, all the different sets, all the different reps. Everything is there. She did an incredible job. So you will get all those notes of some of these different sequences of exercises. And
yeah, and the workouts that I did put in there are more specific to 20-week workouts for contest preparation, okay? You can modify those, okay? If you know how to put a program, you can modify them with the reps and the amount of sets that you're going to be doing, okay? But if you want to try something different, if you want a great week of workouts, go through them.
Out of curiosity, given that neural adaptation takes approximately 4 to 6 weeks for someone just starting out, what kind of changes do you see that after 3 weeks of training?
so the question was, usually it takes 4 to 8 weeks for neural adaptation. What changes do you see in 3 weeks?
In 3 weeks on my programs, I already see a change in the shape of the muscles, okay?
Go ahead.
It's a little bit of a change, okay? A lot of people will come with me, it's like there's nothing that's happening, and I'll look at their programs. For 3 weeks, they've been doing the same workouts for 3 weeks, okay? But yes, it takes a long time. For some people, it'll take longer than that. Like I said, intensity of training is learned. It took me a full year. When I had already turned professional and then started with a new trainer, the first leg workout that he took me through, I was put to shame. For a whole week, I'd never had that type of leg pain in my life.
There was one story that with an extended set on the leg press,
Yes.
that it went, how long did it go for?
If someone challenges me, that's it. So at this point, I was getting ready for a contest, and I was training with another pro Canadian, Bob Weatherall. And we were going to do, we're doing leg presses, and the last set, we always extend the set. So we do as many reps as we can. So Bob went first. He had to go first. It's our last set. So we were aiming for 20 reps and up. Okay, so leaving the weight the same, but we got to do at least 20 reps and more. So he got to 67 reps. I thought, oh my God. So anyhow, and again, now people are starting to gather around. I thought, I can't let him beat me. I just can't let him beat me. There's no way. So here I'm on the leg press, and I take it 10 at a time, 10 at a time, and I got to 72 reps, and I thought, that's enough. I don't need to do anymore. So it's all up here. It's all up here.
Is that the difference as far as people that are at the highest level versus at a lower level? They just don't get...
Absolutely. It's mindset. It's mindset to want to do it. I've worked with I'll take professional female bodybuilders that have worked with me or going up the ranks, national level. Women that have the chance to work out with me day in and day out, getting ready for a show, have excelled so fast, okay? With the women that come to me for 20 weeks of contest prep, and I don't have a lot of time to get into the gym with them, for me it's consulting on a weekly basis, looking at them, making changes to their program. If they haven't placed in that show, it's because they haven't worked hard enough in the gym. They just don't get the intensity of training, and it's learned, and I just haven't had that amount of time to get into the gym to put them through what a real strip set is supposed to feel like.
How do you teach intensity? How can you teach that?
You have to be there with the client, okay? And you know it right away. You'll go into a gym and a female will say, well, I can only do 10 pounds for side laterals for 15 reps. Okay, so they grab those 10 pounds, they've gone for 15 reps, they haven't stopped. I'll go, oh, that's way too light. I can't do anymore. They'll grab the 15 pounds and we'll get to 15 reps. I'm there behind them, I'm motivating them. They may have to stop at 10 reps, and it's like, don't give up. Don't give up. Take that time, take that rest, you're going to do another rep, and they'll go for it. Okay? But it's a lot of motivation there. You've got to learn, it's a little bit painful, but it's a comfortable pain. Okay? And you do, depending on what your goals are, okay, you've got to take it that extra step up. And also, having a training partner also helps, okay? Because not only are you training with that person, but you're also always competing with that person.
Let's try the hamstrings, the butt, and the abs.
One circuit that I love to do, okay, is starting with the resist the ball against the wall. So your ball wall squats. I'll do it down here. You can see me, but
Maybe not.
no.
Let's
Okay,
try it
so
over
let's
here.
do a ball wall squat.
You know what? We'll go against this wall.
Wanna
We'll just
see me
move
do
it. Yep.
Okay. Most important, listen, most important is keeping the tension on the quad. Up and down, okay? I don't know if you'll be able to see it.
Yep. They'll see it.
Okay, we're going to go from a ball wall squat. We're going to go to lunges. We're going to go to step-ups. We're going to go to resist the ball hamstring. And then I'm going to show you just a hold for in between. And then you're going to do the circuit again. But I'm not going to do full reps. Okay. Ball wall squats. Again, feet shoulder width apart. Hands out in front. We're going to start with no weight. Later on, when we make the exercise harder, we add more resistance. Okay? So, again, what's comfortable for the individual. Okay, so I'm here. Come down. 1, 2, 3, 4. I'm going to do 20 reps. My whole body is tight. Got to keep your core tight. Okay? Lean against the ball. Nice and tight. Down and up. Not locking out at the top. Continuous tension on your quads. Stretching out the hamstrings. Down, up, down, up. "20 reps. We're going to come right into lunges. Okay, no rest. Nice deep breaths. Step, push. Step, push. Step, push. Step, push. Done my 15 reps. I'm going to go to a step up. That bench is pretty high. So,
Is this too high?
that's high.
That's high.
I'm
So how
gonna
high do you
step.
normally go?
A Reebok step with 2 things underneath.
Reebok step with 2 things. Okay.
That's a high bench. So, one leg at a time. You're going to go up, up, down, down. Up, up, down, down. 10 to 15 reps on each leg. Switch the leg. Up, up, down, down. Okay? You're going to go right back to your resist the ball. So you can do this at home. There's no excuses. Feet on top of the ball. Hands are at your side. You're going to lift your hips. This is all core. Feet are flexed. I'm going to bring the ball in, out, in, out, in. Feet are flexed. 20 reps. This is my rest period, which is no rest period. Okay? I'm going to lift up. I'm going to squeeze my butt. I'm going to squeeze my legs. I'm going to squeeze my knees together. And I'm going to hold for 30 seconds. Core is all tight. Stomach's nice and tight. When you get better at this and just holding, okay, you're going to come up on, this is for the rest period. Okay? As soon as you've done that for 30 seconds, right back to the squats. You're going to do it 3 times. Okay? When you get better at holding this, then we're going to lift one leg up slightly and point the toe for 15 seconds. Okay? So you're really not taking any pressure off your butt, hamstrings. Okay? And you're going to feel this in your inner thighs also. Okay? That you can do at home. And that's one circuit. Keep switching them around. You want to keep your clients interested. So I can do that same circuit, okay? The squats. I do like to always start with squats because it gets the legs nice and warmed up. Instead of doing lunges next, do the step-ups. Go to your lunges. Always the hamstring resist. And then instead of doing just the stabilizing, you want to do some abdominal work in between. So, one workout, do all lower abs in between. And work up to 50 reps on a lower ab exercise.
What would that be? What would be a good lower ab exercise?
Again, if you're at home, okay, watch the lower backs. Okay, just need a mat to do this. Hands under the butt. Okay, lying leg lifts. Simple. Legs come out nice and tight. You've got to keep everything tight all the time. You're going to come up, crunch in, control on the way down. Up, crunch in, control on the way down. Okay? The other way, make it a little harder. Again, hands are under the butt, straight out. You're going to come in, lift up, control on the way down. Remember, you're doing this as the last part of your circuit. It becomes really hard. Okay? The other one is a tap and curl. So I tap down with my toes and I curl in, squeeze. Tap down, curl in, squeeze. Tap down, curl in, squeeze. Okay? And those are exercises that you can do at home.
Laura, if you have someone who can't do that initially, if you're starting with a lady who's had 3 or 4 kids, possibly post C-section,
Yeah.
what's an easier version of that? How do you start them on that?
So what's an easier version of that? Which exercise? The lower ab one?
I find a lot of women can't do that once they've had 3 or 4 kids, and particularly if they're post C-section.
And I won't. I won't have them do anything. Okay? Until I've strengthened them up with just doing their weight training exercises. I'll just wait an extra week or 2. Or I'll just start with very, very light upper ab work.
But then how do you transition to the lower? Like by working the upper abs, you're not going to be able to do lower leg lifts, would you say? Like,
You've got to start slowly. You've got to start slowly.
When you work the abdominals, you work the entire focus. When you're working lower and upper, there's still a big controversy. Can you do that? You know, there is some research showing that you can do that. Depends on the angle. But if I'm going to do a crunch, I'm working everything because basically the abdominals attaches from here to here. So if I'm crunching, the entire musculature crunches. Correct? So you're still working the entire abdominal area.
yes, but with the different innervation, there's different nerve segments going to the upper portion of the abs, the upper T
Yeah?
nerves than the lower ones. And I've seen women that show some ripping and interdigitation in the upper part, but they can't rip that lower part. And they've got the big jelly roll in the lower part, and they've got ripping in the upper. So if they don't know how to talk to that area, what I'm asking is how can you start to teach them that process? Do you see what I mean?
That is more rehabilitation as opposed to training. So Shirley Sharman's work, Paul Chek would basically be great in those different areas, but that's not necessarily an exercise. That's more rehabilitation. That's a completely dysfunctional muscle. So that's almost like an injury, especially with a C-section. Yeah.
Yeah, because I mean, I've worked with several pregnant women. I've taken them from when they're 3 months pregnant, weight trained till the day before they've gone in for a C-section, and we're right back at it 6 weeks later. No, they say they feel it. No, I can't feel anything. But there's no pain, okay? And I will slowly have them work with the leg lifts. Or we'll do a seated V crunch and start very slow. But everybody's different.
Yes? So the question is, if I can do 5, do more, do I cheat a little bit more?
That's the way to challenge your client, okay? Let them feel it at least once, okay? At least they know that they can do the weight for a few reps, okay? I wouldn't have them do that same weight for the next set, but I will challenge them for their second set. The third set, we're going to go a little bit lighter again, keep the form for all the reps. But even if they get 5 reps, they go, wow, I can do it. So do keep challenging them. But as a trainer, you should be able to notice, you know, how out of form are they getting. Don't let them hurt themselves either.
Yes.
You mentioned switching from lower abs to upper abs. So
Yes.
what would be some of the exercises for the upper abs?
So exercise for the upper abs you want to see? Okay.
Easy home crunches, okay? Just keep varying them. And I like to do, when I'm doing that type of circuit, I like to keep it to 30, okay, and get 100 reps in between each circuit. But you got to work up to this. Okay, so here we go. You've got your regular crunches. Whenever you're doing a crunch, squeeze your knees together. It takes the pressure off the hip flexors, makes you use your upper abs more. Hands behind the head, and crunch. Crunch. Now we're going to vary this, okay, into froggies. Heels together, just let the legs drop. Now you're going to feel the crunch all the way through the abs. So crunch, crunch, crunch. I'm going to vary the leg position. I'm just going to cross one leg over the other. I'm going to crunch, crunch, and I'm going to switch the leg. Okay? Now I'm going to bring the leg straight out and cross. I'm going to crunch. There's so many variations. They all work and they all feel different. There's a different pull on the stomach. Switch the leg around. Okay? Now keep the legs bent. Bring one leg out, slightly turned out, point the toe, and crunch. Okay? So those are all your variations, wanting to do 30 of each. Working up to 100 in between the circuits. Okay? That's your rest period.
Yes? What are some good exercises for abs for osteoporotic women? Why? It's contraindicated? So you're saying that they can never bend over? Who didn't recommend it? Osteoporosis Canada? And US. And did they have research behind this? Who did the research? How severe are these osteoporotic people? So this is real severe? Not osteopenia, but osteoporotic. Okay. So that's the, you know what? That is, when you're dealing with severe osteoporotic, that is a completely different aspect. So there may be some contraindication in that area. That's, okay. Right, right. But with the research, also the thing that rebuilds the bone the most is compression. So would that be a contraindication? Okay. Okay. So there's different ways of doing it. Okay, but that's a real that's a pretty dysfunctional aspect. Yes. Thank you, by the way. I just learned something. Thank you.
Transverse abdominals, good exercise for initiating transverse abdominal contraction.
Transverse abdominal.
Okay. Again, what I like to do in between is either, there's not that many exercises. And again, I like to focus this doing at home so that you're not spending that much more time in the gym. So just sitting down, stick twists. Okay, in between. So you're looking at 30 seconds, nice and controlled, back and forth, nice and controlled. Okay, or, okay, again, leg crossed over, arm out, reaching up, elbow to opposite knee, okay, and then just dropping the legs to one side, hands behind the head, lifting up.
Isn't that more obliques though?
We're still stretching through.
Now, can I say something about the transverse abdominis? I was in, about 3 years ago in Montreal for the World Low Back Congress. Richardson and ʟᴘ were up on stage, and I had the opportunity. I was sitting beside Stu McGill in the audience with Jacek Ċołowicki, and these guys are both PhDs and the whole thing. And they're talking about the transverse abdominis, how it fires before, and the speed and everything else. And Stu looks at that and he goes, yeah, that's true if you don't have a weight in your hand. As soon as you have a weight in your hand, all of that is irrelevant. So all of these different TVA exercises, are they important? Yes. Are they the most important thing? No. This whole stability concept has gotten so out of range. Like, I mean, you have probably the most stable characters here on the planet. Guys that are squatting over 1,000 pounds. You know, can they stand on a ʟᴇsᴜ ball? Probably not. You know, they would breathe heavy if they did that. But the thing is, they're very, very stable. So you always have to take a look at stability concepts. In the TVA, does it play a part? Absolutely. Is it the most important part? It's a piece of the puzzle. It's again that someone has taken a concept and made it bigger than actually what it is. Are there some people that it's really important with? Yes. But when you start taking rehab concepts and start firing them into basically into a bodybuilding concept or into a powerlifting or any sports orientated, it doesn't work. Squatting on top of a ball, all that does is make you good at squatting on top of a ball. A lot of times there's no transference to the actual sport or endeavor.
I like to admit, I like to keep it simple. The weight training program is one part of what you're putting together, okay? To get the ultimate goal of what that person wants to look like, face it, I mean, diet's going to come into this big time, okay? Again, possibly to adding the proper supplementation. So the weight training is just one piece of the pie of it. But again, I like to keep it as simple as possible for the client, okay? Unless it becomes that sport specific. And believe me, if within a 20-week period, you can do a full body transformation as long as that person is willing to do all the work. And I don't have any before and after pictures, but I have worked with a lot of clients over the past 15 years. And I have made some major transformation with people, and not just athletes. So when people say 20 weeks, well, that's not a long time. That's plenty of time, okay? But it takes a lot of work. I had a cousin that I worked with last year at 260 pounds at 5'2". Nothing fancy, okay? First 100 pounds I wanted her to lose, all cardio. Nothing else. Cardio and proper menu plan.
What's
okay?
your cardio program?
2 hours a day, okay?
On
In the
what?
morning,
Of what?
walking outside. Second one was on the treadmill, okay?
What speed?
260 pounds. Do you know what? I asked her to always work up to at least 4.0.
Okay.
Okay? By the end, I mean, as she's getting lighter, she's 4.2, she's 4.5, then it's running. Okay? 8 months of work. Now, this was her goal. She finally came to me, turned 40, I can't take it anymore. Okay? 8 months, down to 128 pounds. All of this is being updated on my website. It's phenomenal. When you get a chance, go to my website. All those pictures will be up in 2 weeks. After the 100 pounds came off, we started a weight training program. How did that start? Full body routine. Okay? Then we started to lose more weight by just introducing the weight training. Then I added in just some ab circuits. Okay? Last part, now we're doing some of the butt hamstring exercises. Now what's going on is she goes to a doctor, a lot of loose skin. I can't do anything about the loose skin. So surgery's coming up. The doctors can't believe at how much muscle tone she has in that short amount of time. Okay? But it's determination to want to do the work. Okay? So I can take, and I've taken so many athletes that come to me from a 20-week period that have to lose 50, 60 pounds and made them the best they can ever be and up on a stage and winning shows. But it's a combination of putting the weight training program together. The menu plan has a big deal to do with it.
One of the things is stairs and steps. Are you still a big advocate of that, of the whole glute ham area?
Stairs definitely work. Although again, it's very stressful on the body too. So, and again, it's just time consuming. My high-end athletes that have the time to do, I still will have them do stairs. Okay, so 8 flights of stairs where you march, run up the stairs, walk down. Okay, but again, I don't want to burn a lot of muscle size. Okay, so with my competing athletes, I have them stick right now to either an upright bike, walking quickly on the treadmill, or using the elliptical. Okay, if I'm having a lot of problem with getting the weight off, okay, I'll start slowly introducing the stair climbing again, or a little higher intensity work. just to re-stimulate the body again. But they're all different, and that's why through 20 weeks, my goal not so much is getting in the gym with my athletes. They come over, I do a physique assessment on them, we make changes to the menu plan, I see how they're shaping up, and I make changes to the workouts for the following week.
Can you do that? You know what? One of her
That takes
gifts.
experience.
Yeah.
That, you know what, everyone can have knowledge, okay? But it's applying that knowledge and having the eye to know what to do. And I may not be able to explain it all to you, but I've had years of doing it, and it works.
What she does, though, is that she actually looks at her clients and changes the program based on what they look like. Could you just do that on me? Like, just what? What would you look at? Like, you know, do you look at the shoulders?
Yeah.
Do you look at the
First
chest?
thing I would like to do with you is build up your upper chest.
Okay.
So I would put you on a 6-week program with double chest workouts.
Okay.
Secondly, after that, the next 6 weeks, I'd put you on double shoulder workouts.
Okay. So what are you looking at? At the weaknesses or the
I'm
strengths?
looking at the weakest body part and building that up first, okay?
Okay.
Then to the next, depending, I'm
Yeah,
thinking
continue.
that's what Dr. Ken is
Yeah.
like. and then go from there.
So what? So
But I do it in intervals.
So you look at what is actually missing in the different areas
Absolutely.
and then put in the different exercises. So if
Absolutely.
someone is in this area, what do you look at within the hips or in the glute area? The size, the position, the shape,
All of that.
all of that?
All of that. You take a look at all of that. And then develop the program to what their goals are, okay? Especially for men, all the men, a lot of the men, bencher's chest. You can tell that right away if you're doing physique assessments, okay? I don't even use fat calipers or anything like that. I do it by sight. And I'm pretty good and fairly accurate at working out calories for people by just looking at them. Bencher's chest. I can tell when a male has done mainly just benching because their chest is concave. It goes in. Bencher's chest does not fill out. So I'll switch them to flat dumbbell presses instead, or incline dumbbell or barbell pressing for 6 months. Watch the chest change.
Laura, what's your website, please?
bodybybinetti.com. Like I said, I have about 15 more before and afters going on there. They'll be up in about 2 weeks. I also this summer had the opportunity to work with a 7-year-old from Columbus, Ohio. And the parents called me, and really, really overweight boy. And I work with their other son, who's a wheelchair athlete. I work with 4, actually, national champion wheelchair athletes. And anyhow, the little boy, really, really chubby. And the other brothers are all in really great shape. So anyhow, put him to a challenge, but a fun challenge, okay? We worked on the menu plan a little bit. Parents had to be involved, okay? So, activity every day, just 20 minutes of activity. I wrote out a menu plan, lots of variety, okay? Basically, you know what? You take out the McDonald's, you take out the candy, something's going to happen, okay? 12 weeks. Did the pictures every week. He was so excited, okay, and so hyped to do this. The one main thing was that there was always rewards, okay? So after 4 weeks, if it wasn't something from Dad, it was always something arriving from Canada, okay? So a Roots shirt or something always. After 4 weeks, a trampoline in the backyard, a different activity. At the end of the 12 weeks, it was a trip to Canada, first trip that he's ever been on, to come see me and visit Toronto, okay?
Wow.
When you see these before and after pictures, unbelievable, but it's making it fun.
How much weight did he lose?
You know, I'm not sure exactly how many pounds he lost, but just the transfer, it's unbelievable. And we didn't want to do jump on the weight scale and that and make it, oh my God,
So you took pictures every week?
Yes.
Do you do that with all your clients?
I don't.
Okay. No, should you?
Yes.
Now, is that motivating?
Yes. Absolutely. Okay? You know what? I get so busy at certain times that I'll ask my clients, please take before and after pictures of yourselves, okay, and keep track of that for me.
Okay.
So that is so important. When you see it, then you really see what's going on.
Okay.
On eccentric loading, like a lot of people will recommend, eccentric, concentric, eccentric.
Don't count.
So you're
But it's quite a bit slower than what you were doing.
Absolutely.
Quite a bit. So, do you ever incorporate it? Do you ever?
What, tempo training, changing the time under tension and all that? You can do that. Laura is explaining what she does with her clients, and she will probably modify that. Am I right?
Yeah, absolutely. But
So-
I will always say power up, control on the way down.
But you're controlling the way down, you know what he's happening. Ever, do 2 weeks of,
No.
no,
No.
do you ever play with tempo?
No.
Tempo training is good, and you can get that way. There's a lot of top bodybuilders. Actually, I don't think there's a single bodybuilder in the world that tempo trains, or at least monitors it. Now, Charles Poliquin, great friend of mine, he's basically one of the originators of it. He's very, focused on that. Very good for sports training, incredible. For bodybuilding, probably not as important, because it's not necessarily a movement pattern. Yes?
Can I see the proper form for deadlifts and mornings? Proper form?
I do mine different too. Deadlift. Do mine a little different. Okay. Again, I'm stretched. My knees are slightly bent. I'm going to stick my butt out. I'm going to take the bar to the front of my toes. So it's down, up, down, up, down, up. If I'm doing a power one, I'm just going to spread my legs just a little bit more, but I'm going to keep my upper body over the bar, okay, and come straight up. So it's down, up, down, up. Now you take a power lifter, you're going to do it completely different, okay? When I'm looking at bodybuilding, what I'm looking at is I just want to feel that totally in the back of my butt and my hamstring. Okay, so most of the times in my programs, again, depending if it's off season or just if it's just shaping, I'm going to have the deadlift at the very end of the exercise, and it's going to be very high reps and lightweight. No.
You don't want to go too far down.
Stretch till it's comfortable.
So standing on a bench doing stiff-legged deadlifts, not a good idea. Because what happens is that when you get down to this position here, you're not working hamstrings anymore. You're basically flexing the lower back. Do you do good mornings?
I don't. I've really taken out good mornings quite a bit in my program. Most important, again, depends. A lot of my in-home training clients don't, so just add a different exercise. Bars here, stick my butt out, keep your back as flat as possible, stretch till it's comfortable, come up. I never lock out, so I like to keep the tension. So it's here, 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 nice and controlled.
Weight behind the shoulder?
Yes, yes. Finishing exercise.
Yes.
I just wanted to ask, at what age did you start to get serious about bodybuilding?
Ooh.
At what age?
At what age do you get serious about bodybuilding? You know, it's different. I've had from 17 right up to starting at 50. So you have to, I was 18 when I started.
Okay, I just want to thank everyone. This was a great session. Let's thank Laura.